morning. I extend a warm welcome to all the people who are joining us for webinar number 16 of 2022 and number 116 since the Andean Health Organization Hippolyte agreement started the webinar cycle in May of 2020. This year we celebrate the 50th anniversary of ORA's Konhu, very sensitive and significant anniversary due to the difficult times we're going through. However, as a reference in health in the region, we continue uninterruptedly to joint and articulated actions with the 6 member countries, Bolivia, Colombia, Chile, Ecuador, Peru, and Venezuela, thus fulfilling the goals and objectives of our Andean countries to improve the health of our people. We would like to continue the webinar, but first we'd like to tell you that vaccination against COVID-19 is safe and effective in protecting others. The more people we immunize, the less likely we are to become infected, as well as protect against severe forms of the disease. Be sure to complete your vaccination schedule. There's no excuse for not vaccinating against COVID-19. Today, Thursday, April 7, 2022, we open our virtual doors with the objective of commemorating World Health Day with the presentation of the agenda for the Americas on Health, Environmental and Climate Change 2021-2030, the analysis of environmental knowledge from the Global South, and significant experiences in protecting the planet and health. However, in every crisis, it is an opportunity to improve. We need to raise our voice and continue protecting people and saving the planet. You can join an initiative defending the environment, local actions, use bicycles, walk, reduce the consumption, and to recycle. We need either the originally people that had lived in balance with the Mother Earth, overcome this concept of a nature being for production, join with the nature. We invite you to leave us your name, your organization, and country from which you are joining us in this webinar through the comment box in the Facebook live chat or YouTube live chat. In the same space, you can leave your questions or send them via email, webinar@orasconyu@gmail.com. In this webinar, we will follow this dynamic. We will start with the institutional greeting, followed by the speaker's presentation, the active break, and we will end with the Q&A session. To access the certificates of attendance of this webinar, as usual, in any of the Facebook Live or YouTube Live chats, you will find a fixed link where you must fill out a brief survey and then leave your data for the issuance of the certificate of attendance, which will be sent in the coming days to your email. Begin this important day, Dr. Carrie Davila has a word, who is the Executive Secretary of Horas Con You, and will give the institutional welcome and greeting. Go ahead, Dr. Calle. Thank you very much, Orly. Well, the Andean Health Organization Hippolyte Agreement, or ASCONHU, was established by decision of the Ministry of Health of Bolivia, Chile, Colombia, Ecuador, Peru, and Venezuela. Last December 18, we celebrated 50 years of uninterrupted work with the vision of making significant progress in the effective exercise of the right to health of the population. I cordially welcome you to webinar number 116, Our Planet, Our Health, to commemorate World Health Day. The World Health Organization estimates that more than 13 million deaths occur each year due to preventable environmental causes: air pollution, water pollution, inadequate sanitation, risk related to hazardous chemicals, and the negative impacts of the climate change are the most pressing threats to public health. The climate crisis is the greatest health risk facing humanity. These health threats are compounded by unjust and unnecessary social inequality. The COVID-19 pandemic has exposed deficiencies in all areas of society and has highlighted the urgent need for well-being and sustainable societies. In Our Planet, Our Health is a powerful reminder We know the solutions, and it is our duty to implement them. The response requires commitment from all of society. It is urgent to take action to maintain the health of human beings and the planet. We can all contribute to clean air, take care of water and our Mother Earth, join projects in defense of economies that focus on the health and the well-being of all people. At Horas Conju, we work to promote well-being and equality in the exercise of the right to health. I must emphasize that the interest in environmental health was a priority issue at the first meeting of health ministers in 1971, in which they resolved to promote an environmental policy and initiatives for the countries of the Andean area, support common positions at the first World Conference on the Environment in Stockholm in 1972. The topic has been present. No, I will just comment some of the recent results during my tenure. In 2020, the Andean Health and Climate Change Plan was approved by the Ministry of Health. This plan was developed by the Andean Health Committee for Emergency and Disaster Risk Management and Climate Change, formed with delegates from the 6 Andean countries, with participation of PAHO and WHO and other organizations. Actions are proposed to strengthen human resources capacities, intersectoral work, research and systematization of experiences and ancestral knowledge, prevention and control of vector-borne diseases, zoonotic diseases, and diseases caused by extreme temperatures, among others. We promote dialogues for the exchange of experiences between countries on environmental health and climate change, and collective work with delegates from the 6 countries in the development of the project promoting sustainable and climate resilient health systems. Joined the global network of green and healthy hospitals and began training in carbon footprint estimation and reduction with 60 delegates from the 6 Andean countries. We have conducted webinars and discussions with experts on the challenges in environmental health, ecosystem restoration, good living, prevention of future pandemics, commemoration of Mother Earth Day 2021 with the theme One Health, among others. Last year, we participated in the United Nations Climate Change Conferences, COP26, in Glasgow, and shared initiatives on the systemization of ancestral knowledge on native peoples who have lived in balance with Mother Earth, good living and social innovations such as telehealth. This year, we continue working on the challenge of achieving universal, sustainable, and resilient health systems, for which, with health without harm, we provide cooperation in training in calculation the carbon footprint of health facilities. In addition, we are systematizing significant experiences of sustainable and resilient health facilities in the face of climate change, and in working meetings, we have reviewed the project with designated national authorities interested in presenting it to the Green Climate Fund. We know that in order to break these cycles of destruction of the planet and human health, it is essential to adopt legislative measures, manage resources, and encourage people to make healthy choices. Today, we will reflect on the agenda for the Americas on health, environment, and climate change 2021-2030. Importance of decolonizing the environmental knowledge of Global South. And of course, we will learn about significant experiences in caring of Mother Earth and water, examples of inspiring actions that are being developed around the world and in the Andean region. Welcome, Cristina Albarracín. Welcome, Daniel Bus, Antonio Ortega. and welcome to all the people who are joining us. Following these greetings, Dr. Paladelo has the word. Institutional greeting. Dr. Valadelli, you have. Thank you. Of course, after these opening words, Mari Carmen, as Executive Secretary of ORAS, we realize the importance that think and analyze the issue of climate change, but to act. You have made an important call to action. I would like to greet you on behalf of the Pan American Health Organization, and also as in my myself in charge of the South program for Pan American Health Organization, and I would like to greet all my friends, the country authorities that are joining us, my colleagues from PAHO, WHO, the group of Washington, and here in Peru. Today, we are commemorating the World Health Day, and I would like to congratulate all of you because you are dedicating your work in health, your time and energy, planet top, in a world where the great potencies are delaying their concrete action. I think it is important this webinar to also we can us contribute. In this greeting, I would like to take the opportunity to mention the sixth report of the intergovernmental experts on climate change, and to explain some of the findings that the report tells us. We're talking about a report that was issued in 2022. So it's quite recent, and it works in a chapter regarding the impact of climate change on health, identifying the increase of climate-related diseases, early death, and also the effects on mental health. According to those projections, at the end of this century, we will have 9 million of deaths that occur due to climate change, in particular related to malaria, childhood malnutrition, diarrhea, among other conditions. The loss of mental health is caused by the exposure to extreme climate events and the displacement due to the temperature increase, migration, hunger, malnutrition, and the destruction of the health systems and social care. And the most affected groups include children under the age of 5, the elderly over the age of 65, pregnant women, indigenous peoples, people with pre-existing conditions, the workers, and those who have low economic conditions. Likewise, it is important to point out from this report that climate change will determine food insecurity because it will affect food production in agriculture cultures, in fishery and livestock, a contamination of the fish products, flooding due to the increase of the level of the sea, access to food for populations will also be affected by the price increase related with the loss of production. The consequence with an increase in childhood malnutrition. Vector-borne diseases will expand towards latitudes and altitudes, higher altitude, either in particular, there will be an increase in vectors in almost all the continents, putting the health of risk of 2.25 billion of people. There will also be an increase of Lyme disease, increase in malaria in endemic areas. And on the other hand, this climate change will affect biodiversity and ecosystem health. This will be decrease in increasing resilience to climate change. They will generate a vicious circle, will result in a high rate of mortality of trees and a reduction in forest productivity. This reduced biodiversity will have a negative effect on mitigation of the climate change and risk management and water supply. For finishing, I would like to mention what Mari Carmen has already mentioned, that we have in the Andean region a plan since 2020 to define adaptation actions to climate change. And in Mercosur, we have another plan since 2018. This plan analyzes the vulnerability of the regions and sub-regions and allow to identify links between health sector and the other development sectors and suggest comprehensive actions to improve resilience of countries and be able to adapt to climate change to protect health. I would like to finally highlight that with HORAS, WHO, and now with the support of CAM, we have developed jointly with the countries of Colombia, Ecuador, Bolivia, Peru, and Chile, a project to increase national capacities that will also be supported by other partners and entities, and we can go to the Korean Republic for the fund to consider funding. Our indigenous people have millenary knowledge that may contribute, and we have the responsibility and the commitment of give voices to the indigenous people. With this, I finish my greetings, and I wish all participants a good meeting, and above all, as the Executive Secretary of HORAS mentioned, to move into action. Thank you very much. Thank you, Dr. Valadelli. After the institutional greetings, my name is Forli Chavez Romero, Public Health and Global Health Professional of HORAS Council, and I am pleased to be in charge of the moderation of this webinar. On this occasion, we will be joined by experts from the Pan American Health Organization, STAN of Granada University, and the organization Aguas Sustainable Water Bolivia, who have extensive experience in this topic that brings us together. After this preamble, we will begin this webinar with a presentation agenda for the Americas on Health, Environment, and Climate Change 2021-2030. WHO Manifesto for Healthy Recovery and other related topics. For this, we cordially welcome Dr. Daniel Booth, who is a biologist with a PhD in public health, with extensive experience in climate change and health, biodiversity, and watershed management, and instruments of social participation in decision-making processes. He is currently the advisor on climate change and health for the Unit on Climate Change and Environmental Determinants of Health of PAHO WHO Washington. Dr. Booth coordinates PAHO WHO technical cooperation with the 35 countries and 18 territories of the Americas on issues related to climate change, green areas, biodiversity, and policies for the protection and promotion of public and environmental. Welcome, dear Dr. Daniel Booth. You have 20 minutes for your presentation. Thank you. I'm going to share my screen.
Falta poner en pantalla completa y estaría bien. Perfecto, doctor.
Perfect, go ahead. Thank you. Dr. María del Carmen Calle, Dr. Baladelli, my dear countries, authorities, colleagues from PAHO, and all of you who are participating today. It's a pleasure to be here with you in World Health Day 2022 with the topic of our planet, our health. And I would like to begin with this reflection on why we are celebrating World Health Day today. In 1948, the World Health Assembly proclaimed April 7 when they founded the World Health Organization, and it's an honor for me to address you from PAHO that since December 2 of 1902, so this year they celebrate 120 years of creation, and it's an honor for me to greet you with this presentation today. I will start with a contrast between the previous slide of the Pachamama of Mother Earth and the spirit of union with a strong image. This is last year's in the US in California that represents something very potent in terms of messages. We see a forest fire associated or getting close to a senior center where you have that information. Wear a mask, wash your hands, social distance, and stay safe. But we see that due to COVID, we have all these messages, but at the same time, the risk, the threat of climate change due to a prolonged drought and high temperatures in California are one of the effects, among others, this forest fire, and reminds us that origin of these two global issues, recent global issues, the pandemic of COVID and climate change, originate in the same, or maybe not exactly the same, but a very similar origin that has to do with how we produce, how we consume, how we use the land, accelerated urbanization that many times with no planning, and that generates pressure over the environmental resources and causing associated problems such as pandemic or climate change, among others. Now, in the last UN Assembly on the Environment, they spoke about a triple planetary crisis, which would be climate change, as we see some representation in the pictures on the left, center, pollution by the use of plastics, greenhouse gas emission, water pollution, and the soil contamination, and the loss of biodiversity and the ecosystemic services that include a loss way of living for many people, especially those who are more vulnerable, who are outside the social protection offered by health systems and systems offered by government. It is extremely important to understand where are we at this moment. I know it's hard, but this is a call. This is a call for joint effort because the issues are aligned, they occur in a similar fashion, and we need to work with these problems in a comprehensive way. Some information that we have at present, as Dr. Calle mentioned, of the agenda for the Americas of health, environment, and climate change that was launched in September of the past year by the Pan American Health Organization, in fact, attributed to environmental risks. And I would like to underline avoidable risks, because these are avoidable. We can avoid these deaths, associated morbidity to environmental risks. More than 1 million people died every year in the Americas due to the inadequate management of water, sanitation, and hygiene, with air pollution, exposure to chemical products, and climate change related impacts that in general can exacerbate system deficiencies in the systems of water, air, chemicals, and others, especially those associated in areas where there's poverty, demographic pressure, inadequate health infrastructure. Quick data: more than 430 million people in Latin America lack sanitation safely managed. Almost 10 million of people in the 21st century, they to defecation on open air. 160 million people have no access to safely manage water sources, and that results in more than 30,000 preventable deaths per year in the Latin American and Caribbean region. With respect to air, 420,000 premature deaths due to cardiac, respiratory, and cancer diseases associated to the poor quality of the air. And more than 74 million people in Latin America and the Caribbean are still depending of polluting fuel like wood, carbon, and kerosene for cooking and heating. And we see the percentage on the right side of the slide. First, this is a very high number of people that have premature death in countries of low and medium income, but it's also too high for countries with high income. But the difference between the two also indicates that the social health determinants are paramount to understand the risk of exposure and death produced by these environmental impacts. And there are the most vulnerable populations who suffer the most with these deficiencies in our system. Now, I would like to take a deep breath here. I don't want to depress you. Once again, the Pachamama, the Mother Earth, reminds us, and there is hope, and that should come from us working together with common goals. So now I would like to tell you some experiences and materials and resources and actions that are being taken in the Latin American and Caribbean region to move ahead with closing the gap that we mentioned and have a more sustainable and climatically resilient and environmentally secure or safe. Starting with the agenda for the Americas on health, environment, and climate change. It was launched, as I mentioned, in the previous year from PAHO. Its origin of the Sustainable Development Goals, especially those that have to do DSOs 3, 6, water and sanitation, 7, energy, 11 of cities, 12, production and consumption, because we have the chemical products, and 13 who have climate change as core action, and also have relevant information in the agenda for sustainable health for the Americas, PAHO, and the PAHO strategic change for the plan for the Americas, and also the global WHO global strategy on health, environment, and climate change. This is the regional action for this global strategy of WHO on this. So, have this call for equity in health of the environmental public health, environment, and climate change, but with a component of equity that has to be evident, strong, and reflected in all the actions that we're going to take in this area. The agenda will be implemented through four topics, central topics, which are not the only ones that have to be worked in terms of health, environment, and climate change, but here these are the central ones that generate dialogue with other areas that are linked to this environmental health issue. One is climate change and health, chemical safety, water sanitation and hygiene, and air quality and health. And the strategic actions for each one of these topics are based in three major strategic actions. One, to improve the performance of programs and environmental public health institutions. We have identified that environmental public health services in many countries have significantly dropped in terms of staff, budget, technical capacities, and therefore this is going to be one of the central strategic actions for the work in each of these themes areas. Number two is to promote that the health system is resilient and environmentally sustainable. This is also reflected not only in the infrastructure of health, but also in training for the health staff to understand the connections between the topics and health, but also in what has to do with the entire health system so they can reduce their climatic footprint and the environmental footprint in terms of sustainable purchases and more environmentally friendly practices. And the third action is to promote that cities and communities are environmentally healthy and resilient, working closely at a local level, not only working at a regional level, national level, but also at the local levels. And that, for example, with the importance of including intercultural dialogues, ancestral and traditional knowledge in decision-making in terms of the implementation of this agenda that we include here. So to hear those who are many times excluded from discussion. Moving on to the second large block of effort and initiatives that we have from the PAHO and WHO. PAHO has launched a manifest for a green and healthy recovery from COVID-19 from WHO, has 6 core recipes. For example, to protect and preserve the source of human health, which is nature. Guarantee that we have the ecosystemic services and nature-based solutions very clearly defined in our policies. Number 2, invest in essential services from water sanitation up to clean energy in sanitary facilities. This continues to be a problem, and many hospitals many times are operating during extreme climatic events and they don't have the adequate conditions where these are most needed. We cannot offer the delivery of high quality services in terms of health. Number 3, secure a rapid and healthy energetic transition that can include health facilities to reduce the climate and environmental footprint of these facilities, but the society as a whole also, and they need to report the other sectors of the advantages. For example, through cost preventives in health interventions that are outside from the health sector. Number 4, promote healthy and sustainable food systems. It is important to consider healthy and sustainable food and their impact on health. All the productive chain has direct or indirect impacts on health. For example, the use of pesticides or reduction of productivity, such as impacts related to climate change as droughts, flooding, or those displacements caused by climate events that make food production is lost. And also without considering the problems caused by the ocean acidity levels that have impact in the reduction of marine production. 5, to build healthy and cities and stop subsidizing pollution. This is something that we need to make progress from the health sector in guaranteeing that the health institution is used to inform about policies and standards and financing of pollution. It is unacceptable that we continue contaminating the world population. And then who pays the bill? Or this is going to arrive at the hospitals and health services that are already saturated. We need to make an investment in efforts on reducing pollution at every level. Some messages from COP26 in the last year. Several of the people responsible are here. Our colleagues, and I will mention at the end some institutions, but they deliver a healthy climate prescription letter that was signed by more than 460 health organizations representing 46 million of health professionals from 100 countries for the COP, requesting support to a comprehensive program with climate and health. Number 2, on your left side, the PAHO issued this report that will be the health argument for climate action. I invite you to read this document and review some of the recommendations from PAHO, WHO, on how to work the climate and health integrated action. And I thank you for this healthy climate prescription letter that were signed requesting climate resilient health systems. 14 of these countries came from the Americas. And since we are horas conjure from the other countries, Colombia, Peru, and Chile sent these letters of commitment indicating that they will build climate resilient health systems. The healthy climate prescription letter and the letters from the countries' commitments are also available. Another output of COP26 on the global level, but with a strong drive on climate and health in Latin America and in the Caribbean, is this network that has all these members. Lancet Countdown, Salud Sin Daño, that are helping us in make progress with the integrated construction of health and climate systems. These are strategic partners. We are happy and it's an honor to be together with this network that has enormous strength to move ahead with the implementation and also the guidelines and thoughts to promote the agenda of climate and health in the Americas. And finally, to talk for the Andean region, perhaps one of the most strategic documents that Dr. Calle mentioned, Dr. Valadelli also, the Andean Plan for Health and Climate Change of 2020-2025, 5 strategic lines, intersectorial work and interdisciplinary surveillance on risk and vulnerability, and to improve the surveillance systems, climate and environment, the generation of the risk maps and environmental maps in order to take the actions directed at a local level with regards to the impact in each population that's vulnerable. In number 3, research to have effect on public policies and mitigation of climate change, adaptation to climate change. It was generated by the Andean Health Committee for the Management of Risk and Emergencies and Disasters and Climate Change from Orasconu. And last year, we had our first forum of the Andean Plan for Health and Climate Change, sponsored by Orasconu, that has a full commitment to their support. And in these plans, what are the actions? Now moving, and I will quickly mention some slides to give you some resources and ideas of how can we make progress with the implementation of these agendas and these implementation programs. One of the lines is to prepare the vulnerabilities to risk and adaptation to climate change, prepare systems of early alert, and systems of resilient health systems using national plans. The contributions determined at the national level of the countries that have health informations, the generations of the observatories, both at the national level, sub-regional level, and regional level for the Americas of climate and health, which I quickly commented. These are integration platform for the data and decision making. I invite you to learn about this Colombia initiative, the Clima and Salud, Weather and Health Bulletin, where every year they generate strategic lines and key thoughts for action taken from the health sector based on climatic forecasts for the following month. This is something to prepare the health systems, anticipating the problems, not waiting until the problems arrive to societies in order to react. In terms of tools for decision-making at the local level of policies and intersectoral actions in terms of evaluation of impact of health and costs for health, we have tools both in the plan, also in the Fund for Climate Prepare for the 5 Andean countries, on green areas, active transportation, air quality, and how can they promote well living. In Colombia, last year, and our colleagues of Colombia are here. Congratulations to you. An analysis that if Colombia does a quick implementation of everything that's been proposed in their country determined contribution, we could avoid 25,000 between 2021 and 2030, and 3,100 deaths can be avoided per year starting on 2030. I won't go in detail, but the economic benefits are up to $12,900 million between 2021 and 2030, and 1.8 million per year, which is equivalent to 0.64 of the GDP of Colombia starting from 2030. If the actions that Colombia committed to do are done in improving the quality of the air of people. So the work on climate change may reduce air pollution and protect health of the people. Finally, the terms of infrastructure and resilient health services. In climate, we have Salud Sin Daño, who helps us in this region for reducing the climatic footprint in health facilities, but also in the entire health system in terms of sustainable purchases. And that is very important because as a health sector, we're responsible between 4 and 10% of the national emissions of greenhouse gas emissions. We have guidelines based for health facilities who are sustainable from the climate point of view. And I would like to invite you to learn about this pocketbook for clinicians, nurses, all of you who are in the front line to learn about the impact. For example, what medication should not be prescribed during a heat wave because they may be exacerbated by the effects of the heat wave. Online courses of water safety, plans for sanitation that are climate resilient. And now in the next 2 weeks, there's a free course, and this is my last slide, a course free of charge with certification by Columbia University in the Global Construction and Climate and Health Education. It's a week classes, virtual classes, but live and with several of our strategic partners and experts from the Latin American region to talk about climate change and health and how can we fight against the effect of climate change on the health sector. Thank you very much once again. This image gives us a very strong message of union, of hope that we can work together and fight the problems of climate change, air quality, water and sanitation, poverty, and other social determinants associated with the environmental issue. Thank you so much for your attention and the invitation. And now I will anxiously wait for your comment. Thank you so much. We thank the intervention of Dr. Daniel Bus, who presented the agenda for the Americas on health, environment, and climate change, whose purpose is to reduce the burden of disease and health inequities due to environmental impact. That these are completely preventable. In this context, we have three strategic lines. One, promote a health system is sustainable and resilient in environmental issues. Promote the sustainable health system in environmental issues. Promote the cities and communities are healthy and resilient. I also comment that the WHO Manifesto for Healthy Recovery in the context by the pandemic by COVID-19, where it is emphasized that during this pandemic, most of our efforts were directed towards the prevention and control of new cases. However, we must redirect our efforts to address the causes of the causes. The environmental determinants of health go to the origin of everything, and that takes us to our interaction with nature and our environmental practices such as deforestation, pollution, the hyperurbanization that creates spaces conducive for emergency of new infectious diseases originating from animal life. We act as if the nature and our environment were not a resource for our health. He also mentioned the Andean Health and Climate Change 2020-2026 of Forest Control, which is aligned with this agenda for the Americas and has 5 strategic lines. All this effort and analysis in order to promote a healthier, more equitable, and environmental friendly world. Dr. Daniel Booth, we thank you again for your lecture and invite you to remain in the room. At the end, we will have a dialogue in response to questions from the participants. Thank you so much. Next, to address the theme, acting decoloniality in the environmental knowledge of Global South, we welcome Professor Antonio Ortega, who is Professor of the Department of Contemporary History and coordinator of the doctoral program of History and Arts of the Faculty of Philosophy and Letters at the University of Granada, Spain. He has 3 consolidated research periods in the National Commission for the Evaluation of Research Activity, CNEAI. He is coordinator of the virtual postgraduate course, Socio-Environmental Epistemologies, Narrative for Re-existence in the Global South, Epistemologies of the South in the Latin American Council of Social Science. Research projects have focused on the study of socio-environmental conflicts and the historical dimension of management. He is a member of the European Society for Environmental History, the Latin American Caribbean Society for Environmental History, and coordinator of the Spanish University Network for Environmental History. He's also a researcher in charge of STAN UGR, South Training Action Network on Decoloniality. He is the author of 6 books and more than 45 scientific articles on this subject. Welcome, dear Professor Ortega. You have 20 minutes for your presentation. Well, first of all, thank kind invitation to Horas Conju to be here and to share with all of you. Thank the presence of Professor Booth and the rest of my colleagues in this session. Well, I'm going to propose is a reflection, as they mentioned, in terms of decoloniality, which is the axis of work of my research trip at the University of Granada, and we developed projects in recent years in Mexico, Colombia, Cuba, and recently in Peru. So our presentation has to do with the area that we are working. We were looking for tools for territorial sustainability, analyzing a more historic perspective, looking at how can we respond to specific challenges at this moment. Well, I think that we have a challenge that Professor Butze identified before. The planet is dying in our hands, and we need to do something now, and we need to do it in all of us. I think that we cannot ignore that many of the problems, as they have indicated through this session and in future meetings, has to do with the idea of human action, anthropogenic factors related to climate change. Our action and our daily practice of consumption and pollution, each one of us do in our place in the planet. And therefore, first we need to appeal to a collective action and also appeal to an individual ethic from a citizen in responsibility in the process of reversing the effects of climate change. Many people are doing this already. Many persons in the rest of the world are doing something I'm going to mention to recover two central elements that can guide us together to what other people are going to propose to a reversion of this model. First, the biocultural memory. Our peoples, our women, men, children in many areas have had tools, ancestral knowledge, have allowed them to have a much more ethical, sustainable life related to their territory with living conditions where their health was not affected, which was healthy feeding and didn't go against the earth way of life. So biocultural memory, the memory as a species, we're one more species on the earth. We're not the hegemonic species. We need to break with this anthropocentric vision. And on the other hand, recover the ancestral knowledge that are going to give us great learning in order to build not only the present, but also the future of this way of life. If we have a challenge in the 20 minutes, where do we come from? So this generation, we are a generation of tyrants. We are consuming the resources, that we're consuming the present and the future. We are eating the future, so we have certain intergenerational tyrants. And this has to do with a colonial way of this use of resources where we deal with the global market needs, where we generate large gaps between North and South. And in that coloniality, what we're doing is eating our future. So I think that we need to think, what do we do where we are? How do we produce, how we consume, and how we give out the resources? The second challenge, in that first challenge, what are they being doing? Where we're going? What is the challenges that the COVID is proposing us, especially in terms of health and food, basically in food where I'm going to pay more attention. How can we come out from that solution? Number three, where can we go or should go? Global sustainability and local sustainability. As Dr. Butze mentioned, we need to respond from the local level over the global level with more climate and social resilience, and to recover certain reflections around the biocentric ethics and the living with the earth, live with the earth and not live on the earth. Well, many people, many leaders, women, men, at this moment in Latin America that have defended the land, have considered the existing resources in this territory, and many of them have given their lives defending land, water, the mountain, biodiversity. And I think that the first exercise is to remember that for a long time, in this last decade, many of our communities, what they're doing is re-existence practice in terms of defending their territory against external threats that have to do with multinational companies and other corporate interests that what they precisely do continue with this prediction of territory. They are the one who have that biocultural memory. Understand, sorry, we're having problems with the audio. The community practices, and I think that the first exercise that we need to think and to resilient knowledge and also resistant defending the territory, a tool, that tool, this environmental justice atlas, where they do a global mapping that interactive of conflicts for natural resources at this moment, current conflicts. This map indicates that we have a major global problem, fraction of natural resources, of global environmental imbalance, generation of negative externality of the model for global development, and that has have a map along the world as we see. It doesn't affect it, it affects many regions. But it is true that we have conflicts because nuclear facilities, mining, water management, infrastructure construction. So there are many people who defend their own territory. I think that we have a first important element that should make us think when we look at a more focal way in South America. Many communities, many places are building a new relationship with their territory, a new defending their natural resources in their way of life. Therefore, here we have an important challenge that we need to respond and work with those communities that they are precisely defending their knowledge and their territory. In many places, I remember some cases, especially working in Mexico, through defending maize as a culture and as a way of life. The knowledge
como visión del territorio, ¿no? Por tanto, la defensa de estos recursos.
Therefore, the defense of these resources are going to give us perhaps with other living conditions and to recover agroecological practices, which is something that I'm going to mention. Central axis of the recovery has to do is, and I think as we would like to call, goes through a path of use of agrochemicals that are the direct cause of health problems, even death and poor health conditions. Therefore, to revert this means go to traditional knowledge and that represent direct consumption activities. this coloniality, following this tool of the Environmental Justice Atlas. The image, the upper image, see, if you visit this map, in each one of these dots, making click, they show the information of the conflict and the map of the territory with image and information of each one. These processes, we see the image in the upper part, the dimension of defense of the indigenous people, those landless groups, those who have no voice are defending their territory against external aggression. A defense that leads to defense of the territory, and sometimes one resistance that leads to, following what Dr. Booth mentioned, that the essential person by NGOs, intergovernmental, etc., that go together with these processes of mobilization, defense of the natural resources of the earth, land, water, mountain, biodiversity, and that allow a mechanism of protection that may allow us to think in recovery with regards to these practices. The resilience that has to do with action and claim. Sorry, we are having technical problems with the audio. We're going to stop the interpretation.
Aquí el proceso central está en cómo muchos de estos comunidades lo que justamente aspiran, desean, reclaman es el establecimiento de políticas de la salud y del territorio que justamente se convierte en una herramienta muy eficaz en el ámbito de la creación de nuevos modelos de desarrollo comunitario y territorial hacia el futuro, ¿no? Y ese proceso da resultados exitosos, ¿no? En la imagen superior vemos muchos procesos que ya están siendo, con el acompañamiento de ONG, de organismos intergubernamentales o internacionales, están paralizando los procesos de recursos o de contaminación de suelos, de agua o de pérdida de biodiversidad, que ya se están paralizando y que por tanto justamente estaríamos ante ese escenario de que antes comentábamos, ¿no? Donde, bueno, estamos en lugar el proceso de destrucción ecosistémica y por tanto estamos ya proyectando la posibilidad de generar proyectos locales de nuevo empoderamiento. Pero entonces llega la epidemia, llega COVID. Llega el COVID y en ese momento uno de los elementos centrales a los que yo quiero prestar atención en los minutos que me quedan tiene que ver con la soberanía alimentaria y de la soberanía alimentaria vinculada a la salud.
Disculpe, Antonio, estamos teniendo problemas con su micro. No sé si es de repente que está chocando el micro o si podríamos ver la forma de cambiar de micrófono.
Voy a continuar mejor, a ver. No sé si,
Okay.
si va mejor, me avisa.
We'll see if the audio improves. Please let me know.
Vale. Digo que tiene que ver con la...
I'm saying that it has to do, no.
Es un elemento central.
This is a focal, a central element in food because COVID, for many indigenous communities, the possibility or the impossibility of trading and exchanging their products. Sorry, we still continue with audio problems.
Desarrollando de mercados comunitarios, de ecomercados, tanto en Europa como en algunos contextos latinoamericanos, hemos detectado, que justamente una de las consecuencias del problema COVID es la recesión de las condiciones de soberanía alimentaria de muchas comunidades, de muchos pueblos. El gasto en alimentos se ha incrementado, los procesos de comercialización agrícola, de importación a exportaciones se han visto ralentizadas, se ha necesitado una mayor intensidad del capital de producción de los sistemas agrícolas, los mercados se han visto perturbados, en algún caso incluso impedidos, y por tanto el COVID-19 lo que ha generado como una primer voz de alarma para los que estamos trabajando en temas de soberanía alimentaria y energética, es el miedo a que justamente lo que se produzca es una recesión resultado del confinamiento y por tanto se incrementen los efectos desiguales tanto en el acceso a la propia alimentación como en los precios de los propios alimentos. Esto genera alteraciones profundas de los entornos alimentarios y esto genera evidentemente un problema de sustentabilidad local y global, ¿no? Y yo creo que es uno de los problemas a los que tenemos que enfrentar de forma inmediata, tanto desde la propia investigación comprometida que podemos llevar a cabo grupos de investigación en muchos lugares del mundo, como desde muchas instituciones. ¿Qué va a ocurrir en el escenario post-COVID? Vamos a volver a fortalecer las redes y los tejidos locales de producción agroalimentaria. Nos vamos a volver a focalizar en recuperar agroecológicos de los territorios, que son sin duda uno de los mecanismos que genera una menor dependencia de las comunidades indígenas respecto a los mercados internacionales y por tanto lo hace más fuerte y resiliente frente a determinadas empresas corporativas y sobre todo resiliente frente al propio cambio climático, en cuanto que podemos redefinir la estrategia de abastecimiento agroalimentario desde los recursos locales, sin verse sometida a determinados procesos internacionales. ¿Se escucha mejor ahora?
Estamos teniendo el problema por segundos. Pienso que es que está muy cerca, no sé si puede alejar un poco el micro.
¿Ahora mejor?
Muchísimo mejor, gracias.
¿Ahora mejor?
Hear me now?
Y luego un segundo elemento que...
And the second element is the dynamic of the food system. The food system generated by COVID have effects on food security, loss of calorie intake, protein, vitamin, and minerals intake due to difficulties of circulation of foods, the food patterns, complications, employment, with a change to cheaper diets, to junk food. So I think that we are facing a complex scenario where we need to act quickly, especially those who are working in food systems, trying to mitigate that this is producing at a local and global scale. This is a challenge, at least for us, where we want to secure the strengthening of diets that have a greater climatic resilience that can support the impact not only of environmental problems, but also for these microorganisms. And I will finish with the challenges in the future, where we have to go. What post-COVID scenarios do we have? We need to strengthen a biocentric ethic, a new living together with the diet. Here, we have different scenarios and challenges in terms of security. The first one, as Dr. Buse mentioned, is the re-signification of other knowledges to relocate our life and affections in the territory. Rejoin the earth for political agroecology, new sustainable production, and the decolonizing struggle, the defense of traditional medicine, of the knowledge learned to that medicine in the territory, actually going back to a process that we all need to do, and those who are in the north, country located in the north, has to do with relocalizing our production and consumption waste, and with that relocation of, we're going to be able to mitigate our ecological footprint, understanding ecological footprint of consumption of matter and energy at a global level, and will generate a positive impact on the effects that climate change produces. I will talk about that in a final reflection. Second element has to do with social justice. Social justice is a core element and can all come together with cognitive justice, understanding cognitive justice as the recognition, social and institutional recognition of this knowledge, ancestral knowledge, together with the academic scientific knowledge. That cognitive justice, I believe, can allow us to walk towards social justice scenarios. And the third element that I think is key is to decapitalize and depatriarchalize our research. A process of research has to open to the society. We need to walk more and more towards more participative research, more collaborative research, open codes. When we transfer the knowledge to society with a completely open code, and I think that there's a central element when defining research. And I'm going to conclude with two reflections that have to do with the process of living together with the earth. Although this may be politically incorrect, I think that we need to decrease growth, not all of us. To coexist with the earth as a challenge has to do with reorientate our growth development towards practices that decrease growth. The countries in the north have a major responsibility in guilt with the big processes of climate change, and therefore the countries of the north need to stop growing, decrease growth, not decreasing the living conditions, but establish new standards of work allocation, the family life, and many other challenges. But I think that the commitment of the countries in the north has to go together with decreased growth, so which means that other countries need to continue growing. It has to do with communality. In many areas of America, we have to go back to the community, to the process that come out of the market logic to establish other mechanisms of living together on a daily basis. It's to do with something that Professor Booth mentioned, the intercultural education ruptures, a new pedagogy. We need to generate new spaces of knowledge production that will allow that all of these transpires to all the members of society. And finally, an element that we already mentioned, and we are working on systems and all these types of issues. I'm very much interested in this biocentric ethic that breaks the anthropocentric vision of the world we have in the last century, recover our understanding with a non-human, with the mindful beings, those that we live together and we nurture in some cases that are part of our diet, but that also have a number of rights that need to be acknowledged, as we see in other places in America and in the world. Therefore, to summarize, I think that there are three central elements that we need to focus. The planet health depends on what each one of us do on a daily basis. We have an individual commitment with the planet, and that commitment has to be fulfilled as best as possible every day. Number two is that this commitment is not only individual and collective, not only with intergovernmental organizations, our government, to which we demand and participate in the design of public policies, but with the creation of community at a local or regional level where we can strengthen practices of reversing the effect of climate change. And the third challenge has to do consumption, with the possibility of feeding from the earth without damaging the earth to build a more sustainable future, healthier future, where our bodies are not affected with the conditions that we create in the earth and impacts our health. From there, thank you for the invitation, and I will wait for the Q&A session. The grateful intervention of Professor Antonio Ortega, who mentioned would like to mention some comments. He talked about the reality of violence against environmental defenders, how this violence has increased, and is centered mainly in Global South, Central American countries, and in the Andean and Amazon space. How the origin of this violence mainly coming from the extractivist industry, and how over the years, with less availability of resources, violence increases in order to secure supply. From the historical point of view, tells us about the process perpetrated by that is in the territories into economic values, where the land becomes the property of those who have the capacity to pay for it. About the post-COVID situation and how the struggle for environmental justice, the colonial struggles, consumer production practices, comes means to put back in the center care of our environment, and where the recognition of the knowledge of the other is vital to this. In this context, we have a collective and individual commitment to have sustainable consumption. In this context, I would like to mention that Orascon includes in its strategic plan a line of Andean priorities in health and carries out actions to invigorate ancestral knowledge through the Andean Intercultural Health Committee, where training is scheduled for the health authorities of Andean countries in the methodology of dialogue knowledge, a methodology proposed by PAHO that seeks the generation of good practices, greater access to health services, and problem solving through a horizontal dialogue, understanding, and trust between the community and health personnel. As Professor mentioned, it will be an important step towards social justice. In addition to training in the dialogue of knowledge, promoting climate resilient health systems in the Andean countries. Among these activities include systematizing and valuing ancestral. Dear Professor Antonio Ortega, we thank you once again for your lecture and invite you to remain in the room. At the end, we will have a Q&A session. Before continuing with the next presentation, we would like to greet all of you who are connected and accompany us from the countries of Bolivia, Chile, Colombia, Ecuador, Peru, Venezuela, Argentina, Cuba, Mexico, Paraguay, Panama, in Japan, as well as the institutions from the Ministry of Health, MINSA, 2 de Mayo, Hospital Globalizan, Work for the Struggle Against Poverty, National School of Public Health from Cuba, University from Colombia, Nectar. We will continue with the next presentation in the experience in environmental care and climate change actions at the local level in Bolivia, for which we welcome Cristina Gabriela Albarracín Mela, has a degree environmental engineer from the Bolivian Catholic University. She has worked since 2019 as an environmental specialist in the organization Sustainable Water in Bolivia, where she has done management, capacity building, and institutional strengthening on issues of water care and watershed management. She has worked on issues related to women's rights, water, and climate change, as well as in the proposal of pilot projects for adaptation to climate change. She's also the founder of the Student Scientific Society of the Environmental Engineering Career at the Universidad Católica San Cristina Albarracín. 20 minutes for your presentation. You have the floor. Good afternoon. Thank you very much. I will start sharing my presentation with you.
Bueno, dentro de Agua Sustentable,
Agua Sustentable, we have several activities in environmental care, and also lessons with climate level. So I would like to start with the experiences in environmental care that we have in some projects that we are carrying out at present and in previous years. One of our projects that is still active is the Lideresas, is a Women's United Defending Water from the Titicaca Lake. These are leader women who are part of the municipality council or who are part of society such as the Bartolinas in Bolivia's society. We have seen that women are part of an important role in water management, in addition to awareness of new generations, because they are the principal portion of the family. It creates awareness in their children, because they see provision of food in terms of take care of children, hygiene, and nutrition. We also see in terms of agriculture, also in charge of the sale and transport of food and how they take care of them, and they also support in livestock efforts. In the highlands, we have the camelite, and also something that we see at present is a challenge in the participation of decision making. The sister of in the picture, she has been participated in the discussion tables to discuss the watershed management of Catay, which is a watershed that ends up in the Titicaca Lake, and unfortunately is the most polluted areas of the Titicaca Lake. This is the area where we've done this work, and the municipalities surrounding are areas where the activity has been carried out. As you can see in this picture, areas of the lake are seen in green color, which are due to the nutrients such as nitrogen and potassium, which creates overgrowth of algae and contamination of the water. Many of these waters are used for irrigation or for livestock consumption or other type of animals such as lambs, which also affects and generated diseases in these animals. And the family has had to invest in other types of treatments in order to cure their livestock. So what have we been doing in this project? We have do capacity building in water quality monitoring by women, as you can see, and this is done with these equipment that are easily to operate. We analyze pH, to see the acidity levels, electric conductivity, total dissolved solids, and temperature, which are the basic factors to follow up the quality. And this helps us to generate knowledge of the current status of the water, and the ladies do this on a monthly basis with this application called Suma Uma. And with this, the information can be made public, and this can be useful for decision makers like the mayor, governors, etc., in order to look at the comprehensive water management of the Titicaca Lake. We're also looking to empower women's leadership in different activities, but also the impact on the young, on the youth, which provided technical tools so they can generate knowledge and look for new knowledge, promote curiosity, generates political impact that help the municipalities and the communities in general, helps to have a governance of water that has more participation and more equity, the different so this capacity building generates participatory information, as I mentioned before, but also the binational meetings, since Titicaca Lake is shared with Peru, and with this we generate new public policies, both at the national level in Bolivia, with the municipalities I already mentioned, but as well at the binational. For example, one of the most recent activities we carry out will be the binational environmental agenda, where we've seen the solid waste management that arrives to the Titicaca Lake have generated a lot of problems at the environmental and health. So with leaders and students with different cleaning campaigns in order to clean the Titicaca Lake and the surroundings, with the goal of generating a solid waste management plan in terms of circular economy. So the solid waste can become the raw material for community and also manage with other neighboring cities that generate this waste, other plans that prevent that this waste comes to the other communities by the river. Another project that we have as actions to address climate change is our high mountain knowledge center that's called Yatin-Uta in the Sahama National Park, which is the first national park in Bolivia. And it's advocated to have a visual and virtual space in which we can show the knowledge on biodiversity in highlands and glaciers, focusing on the Sahama National Park, that these other municipalities of Curaguara and Turco. These spaces where the researcher can come and carry out other type of sampling of biodiversity, fauna and flora, but also a virtual space where they can share the information they have found and the analysis of the previously collected and has public access, especially for decision makers such as the municipality of Curaguara, the Carangas and Turco, and also in the National Service of Protected Areas are not, because they have influence on the national Sahama National Park. And this initiative has 4 pillars. The web page, which shows the Sahama National Park, a virtual library and a gallery of tourist attraction, so the population can visit the communities. We also have the mountain schools to share knowledge from experts in glaciers and biodiversity of high mountain and students at different levels. We also have the workshops, special courses in training of municipal technicians, generating new ideas of adaptation to climate change. And also another pillar will be the adaptation strategies that I will explain next. In the training workshops, we have in the Yatin-Uta Center promotes presentation of workshops on waste, solid waste management, care of the environment, and the topics such as remote access, training in drone management, use to see the livestock, and also with other type of designs that I will describe next, and also do the biodiversity follow-up with other geospatial channels. Also talks and workshops designated for the communities, and also training to the park rangers and other cultural and social activities for the public at large that will strengthen the knowledge and can be share the ancestral knowledge that these communities have. We can all learn about them and share the knowledge. The climate change adaptation strategies in this project is nature-based solutions. What do we mean by this? That to mimic nature, the many ancestral knowledge within this image lower is a way of transporting land where you put water together. So during the rainy season, we can collect water, and during the drought, we can use it for livestock.
Entonces, básicamente,
So many of these efforts are based in imitating nature, using natural material like the adobe. So what we see is to increase resilience towards climate change and reduce vulnerability, which would be less problems such as access to water and malnutrition and infections generated by the consumption of superficial waters to which animals have access. These are other types of strategies done in previous years. Here we have Yaco pump, the manual pump. This pump has 10 years and is still in operation. We taking use of the underground waters for consumption for livestock. In this case, this picture, we see the aero pump, this renewable energy because we use air to extract underground water for human consumption because the community didn't have this hydric resource with them. This other project is extraction of underground water with solar energy, and this water is for livestock because in many communities, in order to obtain water, they have to travel very large distances, and the animal starts losing weight and gets dehydrated. So going to travel long distances to get water and then return to the area of rest has also a negative impact on animals and in the population. And we also have other efforts such as the greenhouse or nurseries built with mud bricks with the soil from the area and generates an adequate environment for growth of vegetables, which is the most complicated area, especially in the highlands, due to the low temperatures. So we have a more favorable environment to grow lettuce, onions, and other medicinal plants that and other herbs that are used to treat high altitude sickness and health problems that can arise in the community. And we have what we do, the continuous training courses with exchanging knowledge with other teachers and other students from different careers so they can come to learn and generate information of the area of the Sahama National Park in terms of biodiversity, glacier studies. We have teachers, Dr. Edson Ramirez, for example, and then Rosa Isela Meneses, who are experts in glaciers and biodiversity. What we are looking, we lost the audio. We would like to encourage research in generate knowledge. In the project, we also have a virtual library where everything that has been researched and published documents in sustainable water and other factors can be accessible to the public at large. We have this virtual library where we have tourist information, so the population can also do their visits and they can have other economic income. This is the geographic information system, a web page where you can have general information on the Sahama National Park and the districts. These are multi-temporal analysis to see what's been going on of how the glaciers receding And the Hakama has been the most affected with more than 50% of loss of the ice surface. We also have the geovisors for geospatial data collection in this area. In addition, that this information from the workshops and courses have public access, and they can just browse and see what information is available and what new information can be generated regarding that topic. My presentation, thank you. We are grateful for the intervention of Cristina Gabriela Albarracin, who spoke about the experience of sustainable water organization in Bolivia. At this point, we want to highlight the cosmovision of the good living of the native peoples, which is characterized by the respect for nature and the understanding of nature as a mother that gives and takes care of life. The consciousness of human belonging to Mother Earth is reflected in an attitude of care of life and defense of nature and understood as a living subject, land, water, soil, subsoil, which requires attention and dedication of human beings. It is conceived that human being belongs to nature, therefore their practices respect the cycles of Pachamama, Mother Earth. The land and water are honored as a mother that provides us with everything we need, taking what is necessary from nature and redistributing the surplus. In Bolivia and other Andean countries, living has been inserted in the development database with the objective of elaborating alternative proposals to overcome the problems derived from the conventional development model. In other words, the Andean region shows the world social innovations in terms of experiences, knowledge, and ancestral practices of good living, which integrate the defense of ecosystems and water as an essential good. After these moments of learning and knowledge exchange, take some time to relax and start a mini physical exercise session while teleworking. Horace who encourages the well-being of those who join us in this virtual session, and in these next few minutes, we will exercise with an active pulse to stay healthy, combat stress, reduce work fatigue, and keep muscle flexible and healthy. Please go ahead with the active pulse.
Hola, hola, muy buenos días, buenas tardes desde el organismo.
Welcome, good morning from the Andean Health Organization and the Politunani Agreement. We invite you to do this relaxation break, a self-massage that you're going to enjoy. Sit down and start. Take your head, tilt your head one side and the other, and start relaxing your neck, your body. Deep inhalation and exhale. Move your head like this, so you can disconnect for a few seconds from your effort, and you can give yourself this self-massage. Move your head towards your right elbow, and with the opposite hand, start moving your fingers from the shoulder to your neck. It's like your hand be walking. It will really help you with your muscle. And inhale and exhale. Inhale through by the nose and exhale through your mouth, going from up and down. Now put your hand on your shoulder and start doing small movements like this from your shoulder to your neck, in the back part of your back that sometimes hurt and are tense, and do some pressure with use some cream on oil, and then you return very slowly. Then you go to the other side and start doing it, going from neck to shoulder with your fingertips, walking the hand, inhale and exhale. Thank you. Your hand on top of your shoulder and press in both directions. Try to relax and rest for a few minutes. These movements in your shoulder area with massage. Wonderful. Now take your two hands behind your neck. Start massaging and slide your hands from the back to the front, like if you were cleaning your neck. So I inhale and exhale. I inhale and exhale. That's it. Now take your hands to the back and move your fingers in the up direction and move your head and use these fingers on all the cervical area. Start massaging in a circular fashion. This is a tension area. That's going to get rid of our headache, muscle pain. Continue massaging. Great, wonderful. With your fingertips. Now we're going to finish stretching. That's going to help us to finish with a relaxation. Take your, tilt your head towards one shoulder. Keep it there for a second. Breathe. I inhale and exhale. And then I switch sides. I inhale and exhale. And my hands like this and pushing my cheek, my chin upwards. Keep it there. Inhale, do a deep inhale and exhale. Now do the opposite. Make force with your hands. And then you go back to all the countries, Bolivia, Chile, Colombia, Ecuador, Peru, and Venezuela. Termoras Kono, we thank you for this tranquility and relaxation break. I hope you enjoy it. Bye-bye. Excellent active pause. To start this dialogue based on the question raised in the chat, I will ask the speakers to please turn on their cameras. During the development of this webinar, our participants have left some questions. We will do our best to answer most of them. First question is to Dr. Daniel Woods. What should be the main allies of the health sector in this approach from the environmental determinants of health, and how to ensure that these collaborations actually meet their objectives? Would you repeat the question, please? Yes, of course. What should be the main allies of the health sector in this approach from the environmental determinants of health, and how to ensure that these collaborations actually meet their objectives? Thank you very much. Quite relevant question. Today, precisely in this event, this regional event, with the PAHO director, the presence of the regional director of the UN program for the environment. It's an obvious connection, not only at the regional global level between UNAP or PNUMA and PAHO and WHO, but also at the sub-regional, national, and local level. This is a direct connection between health and environment. Environmental health determinants will be partially covered here. Integrated effort in reducing the exposures to health due to environmental risks. Now, this is not enough to do, as Professor Antonio Ortega mentioned, it is paramount to create mutual support networks that include those who have always been excluded from discussion, as in the following presentations. It is important to have civil society participating in this. That is why, as I mentioned you, the network that has a more academic look, but it's very important to obtain new information, to offer this, use this information for decision making and based on the evidence. So it is very important to involve all the sectors mentioned from the energy, cities, nutrition, infrastructure, environment, all these SDGs, air, soil pollution. This is a complex problem. It's quite complex. The health determinants are complex. The social determinants are environmental. Health determinants have several different strategies. So we can only move ahead if we have everyone involved in this problem. That is why this triple crisis, I will add poverty and inequality there also, or crisis. It is important to work all integrated because it is not possible to solve the climate problem without solving the infrastructure problems because they are linked to poverty issues, exclusion issues, and the poor waste management and natural resource management. We need to think in a systematic and systemic way if we want to solve these problems, which has such a complex nature. Thank you, doctor, for your response. Second question is for Professor Antonio Ortega. What do you see as the role of government, the care of our environment at the center, especially in context so marked by the idea of capitalism and violence? Thank you for your question. Well, it is one of the challenges. I think that we need to make an exercise as citizens of being able to have influence in public policy, take a more active role. When we propose public policies, governments should be more receptive, more alert, and make a more open process to listen to the society claims, to break dynamics using the concept that I proposed of coloniality. I think that government need to get rid of practices that in some way are colonial and at some point can be influenced by transnational corporate interest and be more permeable to the claims of the citizens. And they also, citizens need to have a commitment of doing an cautious and collaborative in terms of the claims to the government. It's a dual process of commitment, build another possible way of doing politics. Perhaps many of the problems that we have in all countries, not only in the south, but in the north, is how we make policy. I think that the challenge, some of the presentations I proposed has to do with a different way of doing politics. On to the challenges and the crisis that we have at this moment, civilization has a severe problem of continuity facing this challenge. Thank you, Professor Ortega, for your answer. Next question is for Cristina Albarracin. Your experience in local initiatives for environmental care and adaptation to climate change? What do you consider essential for scaling up initiatives to national or regional level? What I consider as of paramount is the commitment. Because many times we say, yes, we need to work, but once we take it to the next level, there's no execution or the authority is not present when the community is decided. I think that would be that part of commitment at the different levels of governance and also of the community. Thank you very much. We thank the speaker for the answers. We appreciate the questions asked. We were not able to answer them all, but we will take them into account to define the topics for the next webinars. We value your participation and interest. Close this Q&A session. I would like to ask the speakers to leave us a message in favor of caring for the health of the planet. In the same order for the intervention, we will start with Dr. Cristina. I'm sorry, my internet dropped. A message for planet care. Well, we only have one home. We don't have another planet where to go. And if we take care of the planet, we take care of our own health. A good environment is to make sure a good health and a long life. Thank you, Dr. Daniel. I fully agree with this message. Well, just to add that together we're stronger because we can go farther and move quicker. That is the only way to move ahead, is to work together and reach those who most need us, the vulnerable and excluded populations. And this is a challenge that we cannot ignore and forget. Thank you. Professor Ortega, go ahead. Well, I agree to what they've mentioned. We are all needed, but some need us more than others. We reiterate our gratitude to the excellent speakers today, Cristina Albarracin, Professor Ortega, Dr. Daniel Bus, to all the attendees who accompany us week after week, the Orasconju team, and to all of those who participate in this activity. We are grateful for the interventions. Now, Dr. Margarita Calle has a word for closing this seminar on behalf of the Orasconju. Go ahead, Doctor. Well, my first word, as always, is to thank you so much, Daniel, Antonio, Cristina, Paolo, who stayed the entire webinar. Thank you so much to Forli and the group from the Andean institution, Jorge for the interpretation, and to all of you that had to do with the webinar. Well, but the question is, what are we doing, each one of us? I think that's a question. It's a question that we should ask ourselves and we should respond, because we know that we are not doing well, that the climate change is the most important against the health at this moment. We know that the planet well-being is needed. It's just one planet. We know that we all need to work together. We know that already. You've given us very clear examples, what Cristina presented, what's been doing, what Antonio mentioned, how is this been doing, and what Daniel told us that there are policies and networks and everything. There's a lot to be done. The Andean Health Organization was concerned from the environment issue from the 1971. 50 years have gone by, and actually we're not doing well. That's the truth. So I think that we all have to do with the situation. If one thing, one only planet is our health, and has to do with the environment, with climate change, with water, with air, with waste, sanitation, has to do with a large number of things. But there is what we can avoid and what we can't avoid. Human beings need to be clear in what we can do. And I think that there are many actions that we can take. That's why I'm asking all of you today through the chat or send us your answer. What are we doing individually for the planet's well-being. We need to start at home, but there's also an important thing that we need to consider. We need to think in the long term. In fact, we need to take action now, but we need to think in the future. Why? Because we are leaving a planet in very poor conditions to those who come later. And I think that there's some debt from us. Many people, let's not leave the country in bad conditions to those who follow us. So I invite you. I was interested with the network. I spoke with Daniel, very important topics that with Antonio we can discuss later. And also, I think that all this effort of Cristina and the projects are so tangible, but I would just like to make two comments. Our governments are not used to the long term. Latin America, our governments are not characterized by making long-term plans. And that has to do with permanence. In these last 2 years, I don't know how many ministers we have, health minister we had in Peru. Well, I could say how many presidents we had in the last 2 years. But there's an issue that we cannot plan for the long term. I always tell one of the first time that I went to Europe, I attended a conference and they gave me a book with all the important conferences that are going to be carried out in the following next 5 years. I said, wow, we hardly plan to what's going to happen next year. We cannot plan beyond that. But the governments need to change that attitude. That look has to be on the long term. And there are conditions and there are situations. I always say that there are lines and strategic lines that are non-negotiable. One of those non-negotiables that need to look for the right for health for everyone. Another non-negotiable is that health is an important pillar for development. With no health, without health, there's no development. Health has to be in the center, although it's not in the center. It's been in the center the last 2 years. When I talk about health, not only health, but also well-being. The third line that I think is extremely important is that health is not something of care and services. Health is a priority of determinants. We know this for years. However, we are tired of repeating this.
Continente o en la región más desigual.
We are in this most region with the highest inequalities. So I think that it is extremely important. And if we don't recognize that it has to be social justice and environmental justice, we're not doing anything. So it's been a pleasure to be with all of you. Thank you so much for your time, for all the excellent things, for all this learning that makes that we start in May of 2020, and we are convinced that this is an important strategic line. Important thing is to learn. As I always say, not only learn and keep our knowledge and store them in the last drawer of our desk, but with the knowledge, continue creating and innovating and working so this world can be more fair and equal. We invite you next Thursday, 11 o'clock. No, sorry, I correct myself. No, it's Holy Week. We invite you April 21st to the day of Mother Earth. The metamorphosis starts. We cannot have to consider these presentations together. April 21, wait for you. Thank you very much to our speakers for staying with us during 2 hours, for 2 hours, which is large. Thank you very much. See you soon. good afternoon, good evening, depending where you are. See you time. Thank you.